All right, I'm going to go ahead and get started. First of all, welcome to the Lifestyle Medicine session on restorative sleep. I'm Karen Dickerson. I'm a physician assistant from Pocatello, Idaho, and I'm certified in lifestyle medicine from the American College of Lifestyle Medicine. So, as an instructor and a wellness coach, I really try and create an inclusive environment where everyone is welcomed and valued. And so I want to make sure that if, as we talk about things today, you understand that nothing I am talking about is judgmental. I'm hoping to pass on information that will help you optimize your health and able to really learn some information that can make you feel better as a person. And if you have questions after I'm finished and you feel like you need to follow up on that, I encourage you to go see your primary care provider to learn what else can be done to optimize your sleep if that's something that you feel is going to be helpful for you. Um, see. So this pillar is on restorative sleep. And it's such an important pillar because you really need to have 7 to 9 hours of high quality sleep, allowing a person's body to reset and recover each day. It's both a biological need and drive, and it's a health behavior. So this image presents an overview of the 6 pillars of lifestyle medicine. And research shows that by following recommended practices in these 6 areas of our lives, nutrition, sleep, exercise, avoiding substances, stress management, and healthy relationships, we're more likely to live longer and healthier lives. So the one that I am covering today is sleep. And I have blown up the wording on this just so you can see it a little easier. And really what we're looking at is um, identifying if there's a lack of or poor quality sleep and knowing that that can lead to a strained immune system and identifying or altering dietary or environmental habits that may hinder healthy sleep. So these are two of the things that is focused on in this pillar. So the objectives today is to really educate you on the importance of good quality and quantity of sleep, what happens when you sleep, how much sleep a person needs, and what is good sleep hygiene. I want to share information to help you get the quality and quantity of sleep a person needs each night. So with that being said, have you ever felt like this, wide awake in the middle of the night? Is sleep really that big of a deal? Well, ACLM believes that sleep is a critical aspect of human health, and it's a foundation which other lifestyle therapies such as diet and exercise are improved. If a person has sleep delays or interruptions, that's been shown to cause sluggishness, a low attention span. A person doesn't really want to be sociable sometimes when they're not getting enough sleep. Their mood may be affected. They may not burn the calories that they think they need to burn, and their hunger may be increased because of what happens to the hormones. And we'll talk about that as we go along today. And then a person's performance can be decreased. So it is very important. Um, According to the Sleep Foundation, positive lifestyle behaviors during the day, such as regular physical activity and adequate hydration, and the establishment of a nighttime routine in the evening can help ensure that you are getting quality sleep throughout the night. Some of the factors to think about as you evaluate if you or a loved one is getting good quality sleep is how long does it take you to fall asleep? How often does a person wake up throughout the night? And that can be for a lot of different things. It may be for noises, it may be a dog, it may be a person has to use the bathroom, and it may just be that they don't sleep too well. and get up throughout the night because of maybe eating too much at night before they go to bed. And then thinking about how much sleep a person gets every night and how they feel in the morning. That really can give a good idea of, is this quality sleep that I'm getting when I wake up in the morning and I feel refreshed and ready to hit the day running versus, oh, I just want to snooze all day, right? Um, and that, that kind of leads to, why does sleep really matter? Well, we've talked about how it's essential for physical, mental, and emotional health. And we're going to talk a little bit more about 5 different things that it actually, um, how good quality sleep helps your brain and body. And so the first one is restoring your body. And while you sleep, your body gets busy fixing itself. And so it heals muscles, it grows tissue, it boosts your immune system. And by doing that, a person doesn't get ill and they feel healthy. The second thing is it clears your brain. And so during the time that a person sleeps, it's time to clean out any waste that might be in your brain. And that could be on a cellular level. It also kind of sorts through memories and helps figure out how to organize those memories. And then a little bit of recharge. So it's kind of like tidying up the brain, tidying up a room and then taking the trash out. The third one is sleep helps a person handle emotions better. So without adequate sleep, it's really easy to feel grumpy, stressed, or overwhelmed. The fourth um, thing that happens when you sleep is your brain practices and stores what you learn during the day. So it's a lot easier to remember things and stay focused if you're getting adequate sleep on a regular basis. And then when you have to bring all that education up that you've learned and you've had good sleep, then it's easier for your body to do that. And then fifth, sleep keeps the important systems in check, like your appetite and your hormones, and even a person's heart. So, poor sleep could throw all of those things off. So, overall, sleep helps your body heal, your brain reset, and your emotions stay balanced. Kind of like when you charge a phone overnight so it's ready to go the next day. Another way of thinking of this is sleep being like a nightly tune up for your body and your brain. And so for your brain, it's kind of like a computer. You have all these tabs open, and when you sleep, it closes all those extra tabs, cleans out all your junk files, and saves the important stuff. So the next day, your brain can run faster and smoother. Your body, if you think of it like an engine, driving all day wears it down. It may get kind of hot. So when you sleep, it gives the engine time to cool off, top off all the fluids, do a little minor repair here and there. And then the next morning, your body's ready to go. As far as the mood, that can be related to a battery. So if a person experiences a lot of emotions or stress throughout the day, that can really drain a battery. So by sleeping, that battery gets recharged, and then the person is more likely to be able to be calm and patient and ready to handle whatever comes their way. And finally, your health is like a garden. So sleep is like water and sunshine to the garden. Without it, the garden of your health starts to wilt and it makes you more likely to feel a little bit off or to get sick a lot easier. So sleep is really overlooked a lot of times. The people need to realize how critical it is to all of the other things that lend themselves to a healthy body. And it underpins diet, exercise, and then just your overall lifestyle and the success of your life. Um, if a person doesn't get enough sleep, as you can see with this little cartoon, they can be fatigued during the day, they can get ill frequently, lack of concentration, experiencing mood swings, and then, of course, that can lead to weight gain, which, you know, lack of sleep leads to chronic health issues. And 4 of them that I've identified here is cardiovascular, diabetes, obesity, and mental health. And so, first of all, if you think about the cardio, poor sleep's a modifiable risk factor for cardiac events. Type 2 diabetes is linked to too little or too much sleep. And so, you got to hit that sweet spot of 7 to 9 hours. Obesity, um, when the body is in sleep deprivation, then there's hormonal changes to the body's metabolism. And these changes can make people feel hungrier than normal. So the less a person sleeps, the hungrier they may feel, and then the more they eat. And that just leads to a vicious cycle leading to obesity. As far as mental health, an insufficient amount of sleep is linked to an increase in sleepiness and feelings of tiredness during the day, which can lead to sharp mood swings, symptoms of anxiety, depression, and even suicidal thoughts. Interestingly enough, if a person is not sleeping well 2 hours, or I'm sorry, 2 weeks prior to having a traumatic event that may lead to PTSD, or 2 weeks in leading to a traumatic brain injury, then those events can have worse outcome. But if they have good, solid quality and quantity of sleep leading to an event that you can't predict, they'll have better outcomes overall. So that's, to me, a pretty powerful lifestyle change that a person can make, is to make their sleep good quality and good quantity. And that way, if they do have an unlikely event, their brain will be better prepared for it. So just think about sleep loss leads to inflammation, and inflammation is linked to a variety of illnesses, including all of these illnesses we just talked about on this slide. All right. Well, let's talk about what happens when you're asleep. So sleep has different stages, and some people have 3 stages that they outline, some have 4. But overall, there are so many different things that happen, and it regulates your immune response and controls the inflammation, like we just talked about, regulates hormones like leptin, ghrelin, and insulin, which can affect the way a person eats. It enhances the vaccine efficacy and the immune memory. So it can help a person stay well and not get sick as likely if they're getting sufficient sleep. It boosts mood, memory, learning, and motivation. And an EEG shows active brain restoration during sleep. And if you look at the picture here, it's really fascinating to see all the different things that happen during the different stages of sleep. And I have another list that are coming up that kind of outlines this. So this outlines the different stages of sleep. And I'm not going to get into a lot of details, but basically each sleep cycle helps with a lot of different things that go on in the brain during the sleep cycle. The next slide will outline some of the things that happen. The other part of this slide that's really important to recognize is, as you look on the bottom, the number of hours a person sleeps. As the hours go up and the cycles continue, the REM, which is the rapid eye movement sleep, gets longer and longer. And so that's important for all of the mechanisms of what happens when a person is sleeping. And this just goes through stages 1 and 2 and shows what happens during, as you fall into sleep. And then stage 3, 4, and REM, it shows all of the different things that's happening during a good night's sleep. This, to me, is a very powerful historic quote from William Shakespeare. "Oh, sleep, oh, gentle sleep, nature's soft nurse." This quote indicates the healing quality of sleep. And if nothing else, think about this: when a person is sick, how much sleep can improve their quality of health and how it can restore health. So, what are the warning signs of not getting enough sleep or not getting the quality of sleep? Well, if a person finds themselves falling asleep every time they get any kind of quiet time during the day, like watching TV or reading or on a car ride. Hopefully you're a passenger, not a driver. Downtime, work or school, or you find yourself having to catch up on sleep during the weekend. That is a warning sign. And what are the consequences? Well, a person's brain may function at a slower level. They may not be able to focus. Reaction time can be off, may not feel as social. They may want to be alone. Emotions feel out of whack, just not right. And a person may feel more irritable and cry a lot more easily. So, paying attention to these things may help a person identify that they can improve their quality and quantity of sleep. Sometimes that leads to a sleep study. And a lot of times that will be a conversation with your primary care. But this is just kind of a funny cartoon of this poor patient getting ready to do a sleep study. Okay, now just sleep normally. However, I have seen a lot of good outcomes from sleep studies to identify things that can be improved so a person can get better sleep, and in the long run, it really makes them feel so much better when they're treated appropriately. So how much sleep does a person need? Well, as a person develops over the course of their life, their sleep goes down to 7 to 9 hours for an adult. When a person's younger, obviously they need more sleep because there's a lot more going on. They're growing and they're developing, and so that makes a lot more sense. In order to get this sleep, sleep hygiene is very important. There is a link, if you can access these slides in the sleep hygiene, to the lifestyle medicine handout. But basically, sleep hygiene is recognizing the impact of lifestyle behavior on sleep, healthy nutrition, exercise, managing a person's stress, and then realizing the impact of the environment on sleep, because it's, the environment, it's dark and then light and then dark and then light, right? And light is the strongest synchronizing agent for what's called the circadian system. And that's the system that your body runs on when they're sleeping. So make sure light is avoided before and during sleep, if at all possible. All right, let's talk about what we've learned. It's important to get good quality and quantity of sleep, right? And you've learned about that. What did you learn that makes you think this way? What sticks out that we talked about today that you didn't know before? What happens when you're sleeping? That was kind of interesting, huh? All the different things that are going on in your brain when you're just conked out. How much sleep does a person need? We talked about this, and it does change over the life of a person, of their life cycle. And then what makes up good sleep hygiene? What is a person able to do to really optimize their sleep at night? So here's a few tips for sleep quality. Establish a regular routine, minimize bedroom lights and noise, move at least every hour during the day, and try and get outside when you're moving to get that sunlight. Stay hydrated. Drinking plenty of fluids throughout the day is really helpful for your overall body quality, not just sleep. And then avoid high sodium foods close to bedtime. So my challenge to you is, what changes do you want to make to improve your sleep? I want you to make a plan, write it down. I want you to tell at least one other person and tell them when you want to accomplish this by, because that leads to better outcomes. When you write your goals down, you make a date, and then you tell somebody. I think you will be very pleased with the results if you make a commitment to improve your quality and quantity of sleep. Thank you for listening. Again, this was brought to you by resources from the Foundations of Lifestyle Medicine, and I thank you for listening.